Hi, I'm Dr. Isabel White. I'm a clinical research fellow in psychosexual practice at the Royal Marsden Hospital in London, and my colleague here is
Professor Mike Kirby, and my clinical work is at the Prostate Centre in London.
We're here to talk about a recently published paper in the International Journal of Clinical Practice. The overall aim of this paper was to conduct a systematic review and healthcare professional survey in relation to the management of erectile dysfunction arising after the treatment of prostate cancer by radiotherapy and androgen deprivation therapy. The importance of this paper is really that it highlights how key it is to perform a baseline assessment, and particularly to look at I can't do it, you're going to have to stop. Just carry on and then
We'll edit that. Yeah.
Okay, so the key point of the paper is, let me start again. The key points for this paper are particularly the importance of baseline assessment, particularly the importance of considering baseline erectile function together with the presence or absence of comorbidities that may impact on erectile function, and whether or not the gentleman is actually taking medication that again can adversely affect erectile function. We also conducted the paper in order to establish a consensus as to the most appropriate way to take management forward in a systematic way within a UK-based NHS system.
I think this paper is really important because the consensus approach does mean that we'll have consistency in approach across the UK. Many of the men I see have been treated elsewhere and often have had very little advice about erectile function. So yes, they've had their cancer treated, but the impact of the treatment on their erectile function has not really been considered. And this is particularly important in the men with androgen deprivation therapy, when you take away testosterone, perhaps for 2 or 3 years, and then of course the penis will lose structure unless they're given help in terms of a PD-5 inhibitor, use of a vacuum device. And I think lifestyle advice is particularly important in terms of daily exercise and weight control. It's a paper that must be read.
Okay, just stay as you are, looking at the camera a minute. And then, should we do it again, the whole thing again? If I count to 5 again.
We can try.
Yeah, we'll just keep on filming. That was perfect length actually, that was 2 minutes and 45. So
he's a natural, you see.
he's had a lot of practice.
Yeah, I have.
It does take practice. Just try and keep looking at the camera too, because your eyes move around too much. So I count to 5 again.
Okay.
1, 2, 3, 4, 5. Off you go. Second time.
Hi, I'm Dr. Isabel White. I'm a clinical research fellow in psychosexual practice at the Royal Marsden Hospital in London, and this is my colleague.
I'm Professor Mike Kirby. My clinical works at the Prostate Centre in London.
We are here to talk to you about a recently published paper in the International Journal of Clinical Practice. The focus of the paper is the management of erectile dysfunction after treatment of prostate cancer with radiotherapy and androgen deprivation therapy. This is the first paper that's attempted to offer a systematic review of existing literature about the management of erectile dysfunction in this group of patients, together with results from a survey of health professionals involved in these men's care. The overall aims of the paper are to achieve consensus in relation to the systematic assessment and management of this group of men, with a view to improving practice overall within UK NHS settings. The take-home messages, I think, are particularly the importance of baseline assessment and considering the men's baseline erectile function and the factors that may influence that function, particularly the presence or absence of comorbidities and the types of medication that these men may be receiving, which can all impact on outcomes in relation to their erectile dysfunction management. We are also, as I say, looking at trying to provide a systematic approach to the management of erectile dysfunction using an algorithm.
This is a very important paper because many of the patients that I see at the Prostate Centre have had radiotherapy plus or minus androgen deprivation therapy, but have had no advice about erectile function. Both the treatment with radiotherapy and androgen deprivation therapy impact very seriously on erectile function, and many of the men, although they get cancer treated, are left sexually impaired by the treatment. There are good treatments available, particularly PD-5 inhibitors, the use of vacuum devices, and also Cavaject. But I think particularly important is lifestyle advice, because the impact of androgen deprivation therapy on the metabolic syndrome is quite serious and impactful, and I think exercise and diet is particularly important in these men, and often that is missed. This is a paper that must be read.